and welcome to a video lecture for veterinary dispensing. This lecture is going to be talking about common equipment and drug order abbreviations. So our first piece of common equipment that we're going to talk about is needles. So sometimes people get confused about the difference between a needle and a syringe. Sometimes people think that needles include the syringe as well, but needles are only talking about these items here where they have the sharp point. So I'm just clicking through to this slide with the notes so that you can kind of see the visual of the words I'm talking about. But one thing that's important to know about needles is that the bigger the gauge number, the smaller the bore. So the bore is like the distance around of the needle. So you can see here our 25 gauge needles are nice and skinny, right? They're not very big and thick and wide. But this guy over here, that's an 18 gauge needle. That one's pretty big and significant. So the smaller the number when we're talking about gauge, sorry, I should be pointing with this finger. The smaller the larger the number, the smaller the number, the larger the gauge, the larger the size of the needle. So 18 gauge is a great needle to use for like a big dog. If you have like a Great Dane or a Lab, an 18 gauge needle is going to be just fine for those guys. But you use an 18 gauge needle in a ferret and you're basically, cutting that ferret in half. It's a pretty big needle. So you would use the little baby needles with a smaller animal. The other thing you need to know is needle parts. So what are the parts of a needle? So there are three things that we talk about when we talk about the needle. We talk about the needle shaft, which is the silver part, the metal part of the needle. We talk about the bevel. So the bevel or the beveled edge on a needle, you can see, I don't know if you can see on here, but they have like an angle to the tip of the needle. And that needle ends with like a sharp, like a knife point. So the beveled edge, when you want the bevel facing up, you want that hole up so that you can see the needle is going to go right into the skin that way then. So the sharp part at the end acts like a knife and just goes right into the skin. If you have it the other way around, it doesn't pierce quite as nicely. It can be kind of painful for the animal. So the bevel is like the slanted end of the needle, the very tip. And then we talk about the hub. So the hub of the needle is just right there where it ends up. So this plastic part there is the hub. So one thing that we need to be concerned about needles is that there is something called dead space. Dead space in the needle is, basically just everything in here. So if we're filling up a syringe and needle with a liquid medication, if we on the syringe measure, let's say 3 mLs of the liquid, it's going to dispense 3 mLs out of there. But they're correcting for that dead space that's in the needle hub here and the needle shaft. So there is going to be some liquid left over in there after you dispense all of the medication out of the syringe. So that means that, let's say we're filling out our controlled drug records. So if we're doing that, we would record that we use 3 mLs of drug, but we're always going to be a little bit out because of that dead space in the end of the needle. So something to take into consideration. Something else about needles, so they all have a gauge, right? So that's how big or round the needle is, but they also have a length. So 1.5 inches is a pretty long needle. I might need to do that if I'm doing like a really deep IM injection. Or if we're using like a larger gauge needle, maybe it's for like a large animal blood draw or something. But for small animals, typically dogs and cats, I'm going to pull blood with like a 22 gauge 1-inch needle. I'll probably use a 25 gauge for like my vaccines. So I personally in small animal medicine really rarely use a 1.5 inch long needle. They're just way too long for anything I need. So that's needles. Needles and syringes kind of go hand in hand. So the syringe is the part that the needle attaches to in order to give an injection. So syringes will sometimes be packaged with the needle attached. If that isn't the case, then you'll have needles separate and syringes separate, and you'll have to put them together. So this portion is like an outer plastic casing that the syringe would come in. That's just disposable. unfortunately, I don't think they're recyclable, which is a shame because it would be good to be able to recycle these. You go through so many. So we have our syringe. We have different parts labeled on the syringe here. So the barrel, that's the part that has the numbers on it for measuring how much volume you're drawing up. So that's the barrel. Then the plunger is the portion that you're pushing on to inject the medication, or you're pulling on to get medication into that syringe. And then at the very end, we have our needle adapter. And then, of course, we have our needle hub, the shaft, the bevel right at the end, and the protective cover that goes over the needle. So we always want to make sure our needles are capped so that, we don't end up with a needle in the eye, which is horrible and scary. So I always say make sure your needles are capped because otherwise, there's potential for injury there. So syringes come in lots of different sizes, as low as, 1 ml is like the smaller of these sizes. You can get like 0.5 ml syringes as well for like insulin injections, or even 1/3 ml for insulin injections. Your typical syringe you'll probably use the most often in clinic is your 3 ml syringes. 3 ml syringes are typically what we'll use to draw up vaccines, and vaccines are probably one of the most given injections in the clinic. And then depending on your manufacturer, you'll either have a 5 or a 6 ml, a 10 or a 12 ml, the 20 ml, there's a 30 ml as well. I think there's 35, it depends on the manufacturer. And then 60 mLs are, as far as I know, the biggest syringe on the market. So we talked about the different parts of the syringe. So we have the barrel, which has the numbers, the plunger, and then the tips. And there's a few different types of tips of syringes. So this is a diagram of the different types that you'll encounter. So we have a luer lock tip. That's this first one here. So the luer lock is kind of like a screw, and you screw the needle into it. So the benefit of this type is that if there's a lot of pressure in the syringe while you're pushing on the plunger, you're not going to send that needle flying because it's like screwed onto the syringe. It's also a little bit easier to uncap the needle because it's screwed onto the syringe. The other type we have is a slip tip. So that's this guy here. It's just like a little tip that sticks out. The needle slides right on top of it. But there is a possibility with this type of syringe that if there's too much pressure in the syringe, it blows that needle tip right off. We also have an eccentric tip, so it's a little bit off center. This is sometimes nice for pulling blood from surface veins. Mostly that's what I would use that one for. I honestly don't really use that one very often anyway. And then there's a catheter tip. So you wouldn't attach a needle to this one at all. It's more for putting like tubing on for doing enemas, like that kind of thing, or for like drawing up large amounts of liquids and then dispensing them where you're maybe irrigating a surgery or something like that, where you're putting fluids onto an organ. You could just use a catheter tip for that. So our next item we have is a pill tray and spatula. So I'll also just call these like counting trays. So these are nice and handy because as you can see, they have like a flat area here for you to dispense with, and it has a nice little spatula for you to count pills with. So ideally, we do not want to touch medication with our hands. There's a lot of potential for contamination because vet clinics are kind of gross. Animals are kind of gross. There's potential for us to have things on our hands that could either contaminate the medication and cause changes to the medication, or it could cause illness in the animal as well. So we shouldn't be handling pills ever with our hands. So what we do with these pill trays, we would pour some of the medication from the manufacturer bottle onto this main flat part of the tray. And then we can flip this part open, and it's like a little ditch in here. We can use the spatula to slide over the number of pills into that ditch. Typically when I'm counting pills, I count by 5s. We do have like a little lab in this course where I'm going to suggest that you practice counting different types of pills and counting in different ways to see what works best for you. I always count in 5s. I think it's fastest. If you count by ones and you have to dispense 120, it's going to take you a lot longer than if you're counting by fives. So I just slide over 5 pills at a time and add them into my ditch here. And once I have the amount of pills I need, I can close this. I can use this portion here. I don't know if it's showing up in the video great. This portion here is like a tapered, and there's like an edge here. You can put the original pill vial over that spot and dump the extra pills back into the pill vial. And then you can use the pill vial that you're dispensing with. You can put it onto here and dump the pills from the ditch into the vial. So they're really handy for counting out pills and dispensing. So basically, we want to avoid touching medications with your hands. You can contaminate the medication. Oh, and good point. This is why I have notes. I forgot about this one. It's also possible for you to be absorbing medication with your hands. We certainly don't want that. There are medications that can be harmful to us. We'll learn about some of those later on in the course. And as well, even ones that wouldn't necessarily be directly poisonous, they can still cause issues. One example would be thyroid medication. So if you have a normal functioning thyroid and you are touching and handling thyroid medication that provides more thyroid hormone, you can end up affecting your body by having excess of that hormone in there too. So we should be avoiding touching medication for our own safety and the safety of our patients. So pill vials, I'm going to go ahead and assume that all of you at some point have had to fill a prescription for yourselves or a family member. So you're probably familiar with pill vials. They come in different colors. So amber or blue, you're going to use if you have light sensitive drugs. You can use uncolored or clear for drugs that aren't light sensitive. Honestly, I just every place I've ever worked with, we just have amber vials and we just dispense into those. They also come in different sizes. The sizes for pill vials are listed as dram. So that's the unit. So I think these are all kind of the same size. These look like probably 30 dram to me is my guess. There's smaller ones, there's bigger ones, and then there's huge ones. There's all different sizes. Ideally, you want to choose the size that fits the medication the best. Sometimes you just don't have a choice because you're dispensing 3 pills. You're just going to use the smallest one, but there's still going to be a lot of space. We can pack the pills with some cotton. That will help to prevent them from shaking around and breaking. But ideally, if you can use the size that suits the medication the best. Sometimes, honestly, I think it's hard to estimate volume. That's something that's tricky for me. Sometimes it's easier for other people, and if that's you, congratulations. But if you're anything like me, it takes a lot of trial and error to kind of build the skill of determining the best size of pill vial to use. So the next point there is stuff with some cotton at the top. You can prevent breakage that way by making the pills not shift around in the vial, and also they absorb moisture, the cotton as well. So typically we don't want pills absorbing moisture from the air, the humidity in the air, because it can damage the medication. And pill vials are available with child-proof caps. Most of the time you're going to be dispensing with the child-proof caps. If you have clients that have arthritis, or like issues with their hands or like mobility issues or something like that where they can't open pill vials, they I'm sure will inform you. If you do have an older client, you may want to ask, like, is a childproof cap okay? Because if it isn't, then you might need to work out a different type of vial to dispense for them. So silica packets. Silica packets are usually included in all medications. We talked about already putting cotton in the pill vials that we're dispensing. That is to absorb moisture. That's what these silica packets do as well. It's a desiccant. You can see it right on there, desiccant. That means that it absorbs moisture from the air. So these need to stay in the pill vial until the pill vial is empty. So if you have a bottle from the manufacturer, you're the first person to open it, that silica gel's right on top, don't throw it away. I'm pretty sure, yes, don't throw them out. They need to stay in the bottle. Otherwise, the pills are going to start absorbing moisture from the air in your vet clinic. So those need to stay in the bottle until the bottle is empty, please. Another commonly used piece of equipment is the pill splitter. So this is one type. There's a lot of different kinds. Basically how these work, these have like kind of a little V shape here. You can put the pill into that V shape and then close the lid on it. There's a blade right here that will cut that pill in half. So why would we want to split pills? Maybe we have older clients that are going to have a hard time splitting them themselves at home. If you have to split pills that are tiny, we should do that in the animal hospital. It's pretty tricky to cut tiny pills into half with like a butter knife at home. If you have to quarter tablets, absolutely quarter those for the clients, because sometimes it's tricky to quarter them and you might end up crushing some of the pills. And in that case, we need to be able to grab more to fill the prescription entirely. If tablets are unscored, we definitely need to split them for the client because the client isn't going to be able to break them. Pills like this, where they have a line down the middle, that's a scored tablet. That scored tablet is pretty easy to break with your fingers. If they're not scored, though, it's tricky to break it. So we can split those for our clients using that pill splitter. Another great time to split pills is if the client asks you to do it for them. And if you just have the time and you feel like being nice, you can certainly split the pills for them. I have worked at clinics that charge people for pill splitting. I personally think that's nickel and diming. I think it's a value-added service we can do. It doesn't take us that much extra time. And it's such a nice courtesy for clients to have halved or quartered the pills for them. So I personally don't really like the idea of charging clients for pill splitting. So another common piece of equipment that we will encounter with medications is biohazard sharps containers. So they might look like this, where they're red. There's also yellow versions. Basically, they're all going to have this biohazard sign on them, and we'll have some kind of warning about how this is a biohazard container. So your sharps container is where you're going to put items that are sharp. So things like scalpel blades and needles, those need to go into the biohazard sharps container. We do have in clinics a biohazard container that's for animal tissue. That's usually going to be in the freezer though, because we don't want removed animal tissues sitting in a bucket on our counter. That's going to start to smell bad. So typically we put those into the freezer. Biohazard sharps containers can also be used to dispose of medications. Unless it's a controlled drug shouldn't go into the biohazard sharps container unless you are working with a company that is licensed to handle controlled drugs, like your company that takes your biohazards. So biohazard sharps should be picked up by a licensed company that is able to incinerate the biohazard sharps containers for you. So these things are called auxiliary labels. These are those little labels that will be like stuck all over your prescriptions when you pick them up. Often we'll have these in vet clinics as well because we want to give them further information that we don't always want to have to type onto the label. So things like shake well before using. You're going to put that on basically every liquid medication. Keep refrigerated. There are some drugs that need to be kept in the fridge. So we have different labels for different purposes. Different clinics will have different ones. So you'll use whichever ones are appropriate for the drug that you're using. You can just stick that right on the label and it's like a warning label or extra information for the client. Okay, so that's all kind of our equipment that we use quite a bit in vet clinics when it comes to dispensing. So next I'm going to talk to you about some of the abbreviations that we use in drug orders. So doctors, I always tease that they're lazy, but they're not lazy, they're being efficient. So what happens is that we see a lot of abbreviations used in prescription orders. So this is something that you will need to know what all these abbreviations mean. I kind of picked out for you here the ones that are used the most frequently and are the most common, and I grouped them because they're all kind of they all kind of have specific or similar meanings in each group. So for our very first one, we might see the word sig disp or RX written, and then typically like a colon, and then some more, abbreviations and numbers to follow that. So Sig, Disp, and RX basically kind of mean the same thing. They're telling you this is a prescription and we need to dispense it. So Sig is an abbreviation of the Latin word signa, and that is for, basically it means these are the words that are going to go on the pill vial. So this is the instructions for the drug. Disp is an abbreviation for dispense, so dispense this drug, these instructions. RX is an abbreviation for prescription. So that's the abbreviation that you're writing a prescription. Our next set of abbreviations here, AD, AS, and AU. And then the next one, OD, OS, and OU. So in all of these, the A, all three of these ones, the A is meaning ears. And for these ones, the OD, OS, and OU, the O is meaning eyes. So I have a picture of my Charlie cat here for you, because the way I remember A is ear and O is eyes is if you think of a cat, their ears are A's and their eyes are O's, right? So that's how I keep that one straight and try to remember which is which. So we know A, we know O, but what is D, S, and U? So D is for the right side, S is for the left side, and U means both. So I don't know if you ever, if you grew up in Canada, it's quite possible that you took French in school, because, it's one of our national languages in Canada. So if you remember, the word for right is à droite, right? It means right. So that's the D is in there for that. That's one suggestion I have for remembering that D is right. And then the S is for the Latin word sinistra. So, I'm right-handed, so I always remembered this by thinking, my left hand isn't my dominant hand, so it's like my sinister hand. I don't know if that really helps you at all. I'm just throwing out what I use to remember these in case that's something that helps you. You're certainly welcome to come up with your own mnemonics to remember those things. If you do have other suggestions, feel free to share them with the class or with me, and I can share them with the class. Because I think that, little mnemonics are good ways to remember things. And then for you, I just remembered, if I connected the both of them, it would be a U, right? Like if I was drawing a loopy line between the two. So that's how I remembered those ones. So A is for ear, O is for eyes, D is right, S is left, U is both. So if on a prescription label, it was written to put 2 drops AD, that means 2 drops. AD is the right ear. So we covered those two. Now we're moving on to this one. So PO, NPO, INJ or INX, and SQ, those are all medication delivery methods, right? So PO means per os. It just means by mouth, right? So PO is by mouth. You could think of the O as oral, if that helps you. Oral medication is, you take it by mouth, you swallow it. NPO means not per os. So again, nothing by mouth is basically NPO. So if an animal is NPO, we're not giving them water, we're not giving them food, we're not giving them any medications. INJ or INJX is a short form for injection. So if we're giving a medication by injection, we would put it that way. And then SQ is for subcutaneous. The cutane, that's referring to the skin, and sub means below. So a subcutaneous injection is an injection going right below the skin, or right underneath the skin. So those are the typical ones you'll see on drug orders where you're dispensing the medication. There are other delivery methods for medications, which we do talk about a little bit later on in the course. But for this section here, we're talking about filling prescriptions to send home with clients. We're not going to have a client give an IV injection. That's just not reasonable. So this section, I'm just focusing on ones that you'll use to fill prescriptions. Okay, so our next section here, EOD or QOD, SID, BID, TID, and QID. I'm gonna start with SID first, okay? So SID means once per day. So I think of it S as in single, right? So single in a day is how I remembered it. It's Latin stuff, but SID, I remembered it as a single pill in the day. So once per day or once every 24 hours. BID is twice per day. B for bicycle has 2 wheels. TID is 3 times per day. So tricycle has 3 wheels. T starts with a T, right? And then QID, if you think of like a quadrilateral, that's like a 4-sided shape, right? So quad is 4, QID is 4 tablets in a day. So SID, we're giving 1 tablet in 24 hours. BID, we're giving 1 tablet every 12 hours. TID, we're giving a tablet every 8 hours. QID, we're giving a tablet every 6 hours. So basically, we just divide the number of hours in a day, 24, by how many times in a day we're giving it. So either 1, 2, 3, or 4. And then that's how many hours the interval should be, or how much time between the medications. And then our very first one there, EOD and QOD. Those both are abbreviations that mean every other day. So EOD is literally E, every, O, other, D, day. QOD, the Q used like that is, Q can mean every in dispensing language. So like a lowercase q is usually what's used. It means every. So QOD is every other day. I personally like to use EOD, SID, BID, TID, QID, because since there's already a Q here, I feel like using QOD might open yourself up for confusion. So I personally prefer to use the EOD abbreviation for every other day. So our next section, again, is how often we're giving something. So Q meaning every, a lowercase q like that. H meaning hour. QH is once per hour. QD is once per day. It's every day. PRN means pro renata. I don't expect you to know that. What I expect you to know is that PRN means you give as needed. So PRN, for instance, like if you have a headache, you might take like an Advil, right? So you are taking Advil PRN as needed. Do you have a headache today? No? Okay, you won't take an Advil. Do you have a headache tomorrow? Yes, you'll take an Advil. You're taking a PRN as needed. Ad lib means you can take as much as you want. It means ad libitum. It's like at liberty. You're free to do as much as you'd like. So for instance, like hand lotion, you could put hand lotion on ad lib. If your hands are dry and you need it, you're going to put on as much as you want. You don't have to worry about overdosing. Okay, so our next one here, the GTT, these are all, kind of like forms of medication. So GTT means drops. So if you're using like an eyedropper kind of medication and you have to give 2 drops, it would be written as 2 GTT. MG means milligrams. Typically capsules or tablets are going to be in milligram format. ml is a volume. It's milliliter. So milligram is a weight. ml is a volume. And if you have like a volume of medication, you'll also talk about a concentration, and that's usually reported as milligrams per mil. SOLN, that means solution. So like a liquid medication is often a solution. And then tab is tablet, cap is capsule. And then our last section there with rep, non-rep. Rep is repeats or refills, right? So you could put that there's 3 refills and the client can come back to get them as needed. And then non-rep means that there are no repeats. And then I can't remember QS and DAW off the top of my head. I'm going to have to check those ones out and let you know. I never use those ones. I don't remember what they are. Okay, so translating drug orders then. So I gave you a couple examples here using those abbreviations. and what it means to the client, like what we would translate that drug order to read. So the doctor's going to write in the file something like this first line: Sig ... 1 tab BID X14D PO. So what the heck does that mean? So we can look underneath. So I want to translate this into a sentence that makes sense for my owners, the clients taking the medication home. But what I can do is, as I go along, I could just translate each thing above and then translate it into a sentence. So SIG just means this is what you're going to write on the prescription label. So you don't even really need to translate that word for me. 1 tab means 1 tablet. BID means twice per day. I don't want to tell clients twice per day though. Clients sometimes get confused. They might not be as knowledgeable about medications as we are, so we want to make it really clear how they're to give this medication. If we say give this medication twice per day, they might give the medication at noon and at 3 p.m. That's not going to work. We're going to learn a little bit later on about dosage intervals and why we need to have a certain amount of time between drugs. Mostly it's because if we're giving a drug every 12 hours, that means that it lasts in the system for 12 hours. So if we give a medication that's supposed to be given every 12 hours with a 3-hour gap, we're going to end up having too much medication in that animal, and it could potentially be an overdose. So we don't want them giving the medications too close together. We also don't want them giving them too far apart, because if they're too far apart, then we're going to end up with having these little blips where the medication is used up in the body and has left the body and isn't being replaced by that next dose soon enough. So we might see that animal not get into the therapeutic range for that drug, which means they're not getting all the benefits that they need. So we aren't going to write twice per day on our drug order or our drug labels. We're going to say how many hours between the doses. So BID is twice per day. In 24 hours, if we're giving a pill 2 times per day, if we have the same amount of time between each, it's every 12 hours. So 24 divided by 2 is 12. So we're going to put every 12 hours. X14D. X is just means like 4 or times 14. D is day. So we're going to give one tablet every 12 hours for 14 days. And PO is our delivery method. We're giving that by mouth. So we want to be clear with clients. I've literally had clients where it didn't say, it just said give one tablet every 12 hours for 14 days. And I've had clients say, so how do I give this? Is it a suppository? Do I put it in their bum? No. Why would that be your first guess? So we want to make it really clear that it's going by mouth so that they don't get confused and put it somewhere that they shouldn't be. So our translation then, you can see here I translated it into a sentence that makes sense for clients. So I like to be polite. I like to include the please. You don't have to though. You could just say give one tablet by mouth every 12 hours for 14 days. If you want to throw a bit of manners in there, please give one tablet by mouth every 12 hours for 14 days. So our next example, DISP. Again, that's just indicating in the file that this is a drug that we are dispensing to the client. I don't need you to translate that word onto your drug label. What you are going to translate, though, is the 2 caps TID X5D PO. So let's break this one down. So 2 caps. CAPS is the abbreviation for capsule. That one's nice and easy to remember. So we know now that we're going to be giving 2 capsules. TID. TID tells us how frequently we're going to do this. TID, T for tricycle. Tricycle has 3 wheels. We are giving this 3 times per day. But remember, I don't want to tell clients 3 times per day because they might get confused about how often they need to do this. So we are going to translate this into how many hours for them. So 24 divided by 3 per day, we're going to get 8 hours. So we're going to give these 2 capsules every 8 hours. Then our next thing is X5D, so that's for 5 days. And then PO is by mouth. So my translation then for the clients, we can use the please or not, to give 2 capsules by mouth every 8 hours for 5 days. So those first 2, those were kind of easy ones. Those were tablets and capsules. That's going to be a really good majority of what you dispense out is pills. Oral medications are, well, I mean, they're tricky to give, but clients in theory can do it pretty easily. These ones are a little bit different style. So the first one here, RX. So again, this is just in the file, it's going to be written RX. That's just indicating this is a prescription to go home. I don't need you to translate RX on your pill labels for the pill vial or whatever. This is clearly a liquid. So 1.2 mLs. So that's a volume amount. ML is milliliter. So if we're doing a volume amount like this and it's going SQ, SQ means subcutaneous, which is under the skin. So that's an injection. And you can see here INJ is part of the prescription order as well. So we're giving a sub-Q injection of 1.2 mLs. How often are we doing it? We're doing it SID. SID means once per day. Usually you can get away with saying once daily for clients. You could translate it though as once every 24 hours. So if you want to be really clear, which I don't think is a bad idea, because again, someone might give the drug at let's say 10:30 at night and then wake up in the morning at 7 a.m. and give it again. And that's too soon. We want to give it at the same time every day if we're giving a medication SID. So SID is once per day. And then X7D is for 7 days. So for how long or how many days are we doing it? For 7. So my translation on this one, we are going to inject 1.2 mLs under the skin once daily for 7 days. So that's our translation of those abbreviations. Okay, so let's look at our next one. So SIG, again, is just indicating this is what needs to go on your drug label. You do not need to translate that for me on the drug label. So 5-GTT. So GTT means drops. So we're giving 5 drops. AU, so remember, think back to our cat face. A on the cat looks like ears, right? So AU is referring to the ears. U is both. It means both ears. So AU is both. Both ears. And then how often are we going to put these 5 drops into the ear? BID. So BID is twice per day. So 24 hours in a day divided by 2 times per day is every 12 hours. And then X10D is for 10 days. And then we have a PRN on there. PRN, we remember, means as needed. So what we're going to write in here is please apply 5 drops to both ears every 12 hours for 10 days as needed. So this might be a prescription that's going home with a dog that has allergies. So allergy problems tend to show up in the ears. So what happens sometimes is these guys get just bad ear infections because their skin is so itchy and inflamed, and then we end up with a secondary infection in the ear because they're scratching at it. So the doctor's saying these are the instructions. You're going to give the medication 5 drops to both ears every 12 hours for 10 days. But we add that as needed because we're basically giving the client permission that if the next time they get an ear infection, they can just go ahead and use this medication again without coming back and getting a checkup. Okay, so I put my hand in front and it changed my focus. Sorry. So that is how we translate drug orders and what we would write onto the prescription labels or the drug labels. So I do have a practice activity for you to practice translating those. If you feel like you need more practice, I'm more than happy to put together some more for you as well. So the next thing I wanted to talk about is drug names. So drugs, there's typically 3 names for each drug. So we're going to play a bit of a game here and see if you guys can recognize these. All 3 are talking about the same drug. So the 3 names that drugs have, the first name they have is the chemical name. So the chemical name basically describes the drug's chemical composition. So the example I have for you here is N-acetyl P-aminophenol. Okay, do you guys know what that is? Any ideas? Any clue what drug that might be? No, not really. Hey, like that just sounds like science classroom gibberish, right? It doesn't sound like anything. So no, we don't really know what that chemical name is. The next name that drugs can be referred to is a generic name or a non-proprietary name. So these are names that are the chemical compound's name. It is usually going to be listed as the active ingredient in a drug, and since it's a generic name, it's not capitalized. So, pardon me. Drugs that are referred to by their generic name tend to be cheaper because the generic manufacturer doesn't do any investment in terms of creating that drug. So they are able to use the research that like the discovering company created to make the drug, and so they can make it for a lot cheaper because they're not kind of trying to make up some of that money that they spent in research. So an example of a generic name is acetaminophen. Anyone recognizing that name yet? So you might recognize it as a generic because this is a fairly common generic in human medication. But maybe you're more familiar with it being referred to by its trade name. Its trade name, Tylenol. So Tylenol is acetaminophen, and acetaminophen is the generic name given to N-acetyl P-aminophenol. Okay, so the chemical name is just the drug composition. Then we have the generic name of the drug, and the trade name, or a proprietary name, that's a unique name given by the manufacturer. So when we think of those brand name drugs, Tylenol, Advil, Benadryl, those are all trade names of a generic drug. So typically your trade name is going to be a more expensive drug, especially if it's the original manufacturer. So one thing that's kind of interesting is that in Canada and the US, if a manufacturer of a drug creates a drug, they have exclusive proprietary rights that usually last for 10 years. I think they can even request to extend it longer. And they can also voluntarily give up those proprietary rights. So they don't have to keep that drug exclusive to them. The reason for that is that it's super duper expensive to research and develop new drugs. So it's not just a matter of discovering something and being like, hey, cool, I think this might work. Let's sell it. They have to figure out how to make it, and then they have to run a lot of studies proving that the drug is safe, proving that the drug is effective, proving what the correct dosages are to give, how often to give, right? So those things all cost a lot of money to do that kind of research. So that's why we have these exclusive proprietary rights for 10 years, is that company can mark up the price and recoup some of those costs. I don't know. So it's a good thing for the companies, right? Because then they don't have to lose so much money in research, and it also incentivizes to create new drugs because you can recoup that money, right? If it was a matter of, hey, I discovered this and then everyone could make it right away, these companies would never get the money back and no one would do the research. So it's kind of an interesting business model, I guess. So after those 10 years are up, those proprietary rights are expired, and now other companies can choose to make this drug as well. And then just one last point, because it's a trade name, the name is usually capitalized, and it will usually have like the R with a circle, right, for a registered trademark, or the TM. So I have a story, I guess, to share of one of the drugs that are very popular in vet medicine, and that is Medicam. So Medicam is the trade name of the drug. and the generic name of it is meloxicam. I couldn't tell you the chemical name, sorry. Basically, Medicam was invented, they did all the studies, they released the drug, and it's been on the market for over 10 years now. But basically, at that 10-year mark, the proprietary rights expired, and then all of a sudden, we had so many other options for meloxicam. So there's like it's called M-aloxin, and that's a meloxicam drug. Anyways, so that's just another one. But that M-aloxin, that's a different trade name. Both M-aloxin and Medicam are both meloxicam drugs, okay? So they're the same drug, they're the same generic drug, but they have different trade names. You might also see, like, you know, you go to the pharmacy and they'll have Tylenol, and right next to it they'll have, you know, like if you're like the superstore pharmacy, they'll have the President's Choice acetaminophen, right? So once we have those generics, we can end up having cheaper drugs, access to cheaper drugs, which is kind of a cool thing. Okay. So that's basically my lecture for today. So the first couple pages of chapter 5, pages 105 to 108, those are going to, you know, give you a little bit more information about what we've discussed here. There's also the class notes as well that you can read. You can see here it says workbook questions. Unfortunately, Elsevier discontinued the workbook, so you guys don't have access to that anymore. And that's why I made that practice activity, because it's mostly, you know, picking apart the prescription, I'm totally trying to blank on the word here. The dispensing abbreviations. Translation. There we go. So that's why I made that translating activity for you guys, that you had some kind of questions to work with on this. And that's it for our lecture for today. So if you do have any questions, please do ask in the chat, or write them down and save them for the virtual classroom. Or you can send me an email. That's good too. So however you'd like to ask those questions, do please ask, because always remember that you are entitled to understand the things that we're learning in class here. So if you do have any questions, please make sure you do ask them. All right, thank you for listening. Have a great day.